The number of people in England waiting to start routine hospital treatment has reached a new high. NHS England says it stood at 7.2 million at the end of October. Separately, BBC analysis shows that nearly 40% of patients in A&E departments in England are waiting at least 4 hours for a bed on a ward. Jim Reid reports.
A&E units across the UK are under serious pressure.
It's not good, all laid in trolleys like this.
From this hospital in York,
ambulance staff are waiting with their patients to come to the emergency department cubicles, which are currently full,
to the Royal Victoria in Belfast, to these corridors in Milton Keynes.
I've just spoken to the nurses and they just asked us just to wait in the queue until they have space available.
Doctors say they're most concerned about the sickest patients who need to be moved on from the emergency department to another ward of the hospital for surgery or more complex treatment.
Near record numbers are now stuck in A&E for hours until a free bed can be found, partly because hospitals are struggling to discharge patients into social care.
If your hospital is full, and more than 19 out of 20 of our beds are full at the moment, that means that it's very challenging for emergency departments to transfer patients from the emergency department onto the wards, and that of course increases waiting times.
You've had a few days of the treatment, you've had some rehabilitation. How's it feeling now?
Well, it's feeling okay really until I stand up and have to use it.
Those long waits in A&E are a big risk for the most vulnerable. In Surrey, 90-year-old Pat is recovering after falling and breaking her pelvis.
With the physiotherapist this morning, did you manage the session?
Well, yes, I had to have assistance to get on the bed.
When she got to A&E, a specialist team sent her straight to a bed here in a dedicated unit for the most frail, so she wouldn't have to wait in pain.
Someone like Pat, it was really key that we could identify her needs very early on, which were around managing her pain, which were around managing her bone health and some of her breathing problems. And it's because of that and that early identification and early work with her that she's now able to actually return home.
Well, it was a shock, of course. I mean, it does shake you up, doesn't it? No, I've got over it really now. It's the anticipation of when you go home, how you're going to cope.
The frailty wards and the team next door in the acute medical centre in Epsom are both designed to take the pressure off A&E.
Do you want to go with Dr. Barber?
The idea is that more complex cases are sent here quickly for treatment before either being referred to specialists or ideally sent home to free up the bed.
We don't want anyone to stay in hospital any longer than they need to, but we know that with an elderly population, to make sure that happens, it needs a whole team effort. We can't just continue working the way we've historically worked.
The government has said there is more money to improve A&E performance in England. But with colder weather on its way and rates of flu also rising, hospitals are bracing for a busy winter. Jim Reid, BBC News.